All right, here's my blank piece of paper. Knock, knock, knock.
Hello.
Hello, Mr. George. How are you today?
Doing all right.
My name's Abby. I'm going to be your PA today. How are you doing?
Doing great.
All right, so what brings you in today?
So I've been having a nagging neck pain that just seems to not want to go away. Doesn't seem to have any injury that I know of. It just kind of has started to be a general pain that's kind of stayed steady.
So when did this start?
It was about 2 months ago that it started. It wasn't really that bad then. And it's not super bad now, but it just keeps constant. It's like it won't go away. I figured, you'd sleep it off or wait a week and it might go away. It might have been some injury, but it just seems to stay there. So I figured I should come get it checked out.
Where in your neck is it?
Around the base of the skull and the back. So I guess the top of my neck, like right where the bottom of the hair line.
Okay. And how long has it been going on straight for the 2 months? And you said it's been getting worse?
It's not been getting worse. It's been getting more constant. Like periods of reprieve are not as long. So more nagging. That it just.
So how would you describe the pattern of the pain? Just becoming consistently more.
Yeah, a constant pain at the base of the neck. I can kind of massage it out and distract me from it for a little while, but it comes back quickly.
How would you describe the pain?
Kind of like a nagging pain, almost like a little bit of a headache, a little bit of a, I don't know if it's in the muscle or what. I wouldn't be sure where it is.
Does anything make it better?
Like massaging on it, and sometimes I take in a leave.
How many leaves do you take?
One a day. Well,
with pain?
Yeah, I don't take it every day, but sometimes. But I usually only take one in a day.
Okay, does anything make it worse, like moving it?
Not really, because I'll try and stretch it out and crack not crack, but my neck, and it helps a little bit, but stays on.
How would you rate the pain on a scale of 1 to 10, 1 being the least and 10 being the worst pain imaginable?
Probably around a 3 or 4.
Okay, so not too bad.
It's annoying. It's not debilitating.
Okay. Does the pain radiate anywhere, or is it just in your neck?
I guess I would say the physical pain doesn't radiate, but it does cause a little bit of a headache. Or it seems similar to a headache. I don't know if it's the neck pain or...
Is it better or worse at night?
It's better at night, but then sometimes it's a lot worse in the morning. So maybe I don't know if I'm sleeping. I don't think I'm sleeping wrong, because it doesn't really correlate with just the morning. But
okay, have you noticed any fever?
No.
Chills?
No.
Have you passed out recently?
No, I've never passed out before.
Have you noticed any generalized weakness, like overall, a weakness or fatigue?
I would say that the pain kind of makes me not weak, but makes me less likely to want to do something, just because I have a nagging, almost like when you have a headache, you don't want to do anything. So I guess if that counts as a general weakness, or...
Yeah. Have you noticed any changes in your appetite?
No, I haven't noticed any appetite changes. Probably eating more just because I'm not going and doing as much.
Have you noticed any weight changes?
Not really, not any. Maybe a little bit of a gain, but no more than 5 pounds. Nothing dramatic.
Okay, so back to your neck pain. Have you noticed any pains in your joints?
Not related to that, no.
Okay, what about muscle pain in the area?
I don't know where it's coming, whether it's the muscle at that area or something deeper, but it's massaging the muscles helps, so maybe that's maybe it is a muscular pain.
Okay. Have you noticed any swelling in the area?
No, I haven't noticed any swelling.
Have you had any stiffness in your neck?
I'd say a little bit of stiffness, but I can still use a full range of motion. So
okay, so you have a full range of motion.
Yeah, I don't have any difficulty moving my neck. I guess I don't move it as much because it is in a little bit of pain. Or maybe I move it more when I'm trying to massage it out. I don't.
Is there any cramping pain?
No, I don't know what cramping pain is.
Okay. Any bony deformities in your neck?
Not that I know of.
Okay. Have you noticed that your muscles are weaker in your neck, or that they're wasting away at all, or no?
No, they seem to be. I mean, when I'm massaging them, they still feel like they're there, and they don't feel like weak or smaller than I've ever remembered them being. So I would think no.
Do you have a history of high blood pressure?
Personally, no.
Do you have a history of diabetes?
Personally, no. I don't have any.
High cholesterol?
No, not that I know of.
Any heart diseases?
Not personally, no.
Heart attack?
No.
Stroke?
No.
Cancer?
No.
Any hospitalizations?
No, not for any injuries or
Have
sicknesses.
you had any surgeries?
I've had an elective surgery when I was 10 years old.
What was the surgery on?
It was a cosmetic hip rotation.
How was that?
Painful.
Are you up to date on all of your immunizations
As far as I know.
and vaccinations when you were a kid?
I went to public school, and I assume I got all the ones that were required.
Do you take any medications?
Adderall for ADHD.
What's the dosage of that?
30 milligrams.
How many times a day?
2.5.
Okay. Do you have any allergies?
None that I know of.
Are you allergic to any medications?
No.
Any environmental issues? Foods?
No, I have no food allergies. I may have a allergy to bees and wasps, but I don't know. I've not really been stung much.
Okay, so not too bad of a
Not a
reaction.
serious allergy. I think I have a little more swelling than a normal person, but I don't know if that qualifies as an allergy or not because it's not like I go into shock or anything. It's just a little extra swollen compared to what I would think is the average person.
Okay. Do you have any other congenital diseases or any other health conditions?
What's congenital mean?
You know, like any other health conditions that you may have or know of.
No, I don't know of any health conditions that I have.
Okay. So do you know if you have a family history of hypertension, high blood pressure in the family?
Yeah, my dad has high blood pressure. I don't know if my grandparents do. May have, but I don't.
That's okay. Any history of diabetes in the family?
My grandmother on my mom's side has diabetes, and then an aunt on my dad's side has diabetes. And that's about all I can think of.
Okay. Is there any high cholesterol in your family?
Not that I know of.
Okay. Any cancers in your family?
Yes, my mom had breast cancer, and my grandpa on my mom's side had melanoma.
Okay.
And my grandpa on my dad's side had prostate cancer. So I guess there's a little bit of history there.
Just a touch of cancer in the family. Do you have a history of heart attacks in your family?
My grandmother on my mom's side had a heart attack when I was a kid, but that's the only heart attack that I know of in the family.
Okay. Any other heart diseases in the family?
My mom has dysrhythmia, or SVT, I think it's called.
Okay.
Something where her heart beats really quickly, randomly, and I don't know. It's not. She's on medication for it, so.
Any history of strokes?
I don't think so. Pretty sure no one in my family's had a stroke that I know of.
Okay. Well, that's good. Are your parents alive?
Yes.
How old are they?
55 and 56.
Mom's 55 or dad 55?
Yeah, mom 55, dad's 56.
Okay. Do you have any children?
No.
Do you have any siblings?
2 siblings.
Brother or sister?
2 sisters, both younger.
Okay. Do they have any health concerns?
Not that I know of.
Okay, well that's good to hear.
Nothing serious.
Do you smoke tobacco?
No.
Vape at all?
No.
Chewing tobacco?
No.
That's good. Do you drink alcohol?
Socially. Probably once a month or less.
Once a month. How much do you drink when you do?
Usually not that much. Every now and then, a good bit. Not regularly though.
Okay. Do you do any recreational drugs?
No.
How is your diet? How would you say it is?
I would say it's pretty average.
Average.
I try to be healthy sometimes, but I enjoy myself, my sweets and treats.
Don't we all? Do you exercise at all?
Yes, usually.
What do you do?
Usually daily I'll do some sort of exercise, whether it's walking, going for a bike ride, or just a gym workout, weights and whatnot.
Good, that's good. What do you do for a living?
I'm an attorney.
An attorney, that's awesome. Where at?
In Baton Rouge.
Cool. Do you have any trouble with finances, with healthcare or anything?
No, I have health insurance, so.
That's good. How would you describe your living situation?
Stable, I guess. I don't know.
Okay.
I'm alive, I have a place to live, and I'm not worried about how to get food on the table or pay the rent, so it's pretty good.
Are you sexually active?
Yes.
Do you use protection?
Yes, all the time.
Have you had any STIs?
I've never been I've never
You've never been tested?
positive. No, I've been tested, but I've never tested positive for anything before.
Okay, so you have been tested.
Yes.
When was the last time you were tested?
Probably a year ago.
Okay. All right. Well, thank you so much for coming in. Is there anything else that we didn't talk about that you wanted to mention?
No, that sounds like it about covers it. I don't know what we're going to be able to do for it, but that's been my main concern.
All right. Well, thank you for talking to me.
Thank you.